This video-based learning is about art therapy. So what is art therapy? The use of artistic methods to treat psychological disorders and enhance mental health is known as art therapy. Art therapy is a technique rooted in the idea that creative expression can foster healing and mental well-being. The American Art Therapy Association characterizes art therapy as an approach to mental health that utilizes the process of creating art to improve mental, physical, and emotional wellness. The history of art therapy. The earliest form of art comes from cave paintings that date back to the Paleolithic period. According to Packard, 1980, humans from this time period may have been used art to psychologically prepare hunters for their long and dangerous hunting expeditions. These paintings portrayed the hunter's fear, hope, and wishes and represented symbolic offerings to their gods. The formal practice of art therapy has its origin in the mid-20th century Europe by British artist Adrian Hill in 1942. Hill is a World War I artist who later suffered from tuberculosis, saw the benefits of drawing had the healing process while hospitalized for his illness. Eventually, he had to lead drawing and painting classes for other patients who he believed benefited from the class. It took their minds off of their ailments and relieved their mental distress. Doctors noted that individuals suffering from mental illness often expressed themselves in drawings and other artworks, which led many to explore the use of art as a healing strategy. Since then, art has become an important part of the therapeutic field and is used in some assessment and treatment techniques. The uses of art therapy. Art therapy can be used to treat a wide range of mental disorders and psychological distress. Anyone can use art therapy. In many cases, it might be used in conjunction with other psychotherapy techniques such as group therapy or cognitive behavioral therapy. Some situations in which art therapy might be utilized include children suffering from behavioral or social problems at school or at home, adults experiencing severe stress, people who are experiencing mental health problems, children or adults who have experienced a traumatic event, individuals suffering from brain injury, and children with learning disabilities. Some conditions that art therapy may be used to treat include: number 1, aging-related issues, anxiety, cancer, depression, eating disorders, emotional difficulties, family or relationship problems, medical conditions, psychological symptoms associated with other medical issues, PTSD, psychosocial issues, stress, and substance use. How art therapy works. An art therapist may use a variety of art methods, including drawing, painting, sculpture, and collage, with clients ranging from young children to the elderly. Clients who have experienced emotional trauma, physical violence, domestic abuse, anxiety, depression, and other psychological issues can benefit from expressing themselves creatively. Some specific settings where art therapy might take place include art studios, colleges and universities, community centers, correctional facilities, elementary school and high schools, group homes, homeless shelters, hospitals, private therapy offices, residential treatment centers, senior centers, wellness centers, and women's shelters. Limitations. While research suggests that art therapy may be beneficial, some of the findings of its effectiveness are mixed. Studies are often small and inclusive, so further research is needed to explore how and when art therapy may be most beneficial. So, one question to see what you have learned from this lesson. So, who can use art therapy? Please answer in your own words.